a little bit about diabetes at some point in your life, or you may even know someone who has it. But did you know that type 2 diabetes is completely preventable? Let us explain. Or let Khan Academy explain.
Your body needs sugar, or glucose, to function. This includes using your muscles, helping your brain to think, and performing daily activities. Your pancreas is the organ that takes care of the sugars you eat. Whenever you ingest sugar over here, your pancreas secretes what is called insulin. And insulin is the key that will let the glucose in your cells be used. Insulin comes out of here to absorb the glucose. If your pancreas is not secreting insulin, then your body cannot use the sugar in your blood and it just stays there, causing high blood sugar. In other ways, your body can become resistant to insulin, which is like losing the key to unlock the gate. Once again, the sugar will sit in your blood. Diabetes is when your sugar runs in your blood at dangerously high levels. This can cause a lot of problems, including kidney failure, foot ulcers, and nerve damage. Type 2 diabetes is the most common form, affecting over 90% of diabetic patients. What happens is when a person consumes too much fat or sugary foods and drinks over a long period of time, their insulin gets tired of working so hard to keep up with all the glucose. Eventually, the insulin poops out and stops working for the high blood sugar. This leaves the patient with high ongoing blood sugar. Type 1 is a little different. It happens in people under the age of 30. Type 1 diabetes is not a preventable disease, but it is an autoimmune disease, which means the body is working against itself. Type 1 diabetic patients have cells that are attacking their own pancreas, making it unable to produce insulin. Without the insulin, the sugar in the blood cannot be used up by the rest of the body and stays in the blood. Risk factors that influence the cause of diabetes are obesity, sedentary lifestyle, high cholesterol, and hypertension.
So the signs and symptoms for type 1 and type 2 diabetes look a little different from each other. The signs and symptoms of type 1 diabetes includes thirst, hunger, and constantly using the restroom. Mm-hmm. This includes also weight loss, fatigue, increased frequency of infections, and it has a quick, rapid onset. For type 2 diabetes, it has the same thirst, hunger, and constantly using the restroom, but obesity and fatigue, increased frequency of infections, and it has a gradual onset, so slowly over time. Preventative measures to not get diabetes would include you want to have a healthy diet, so that includes a high amount of fiber, which can include lots of fruits and vegetables, legumes, and beans. You want to decrease your amount of intake of red meats. So you want to eat like nuts, you want to eat low-fat dairy, poultry, fish, and whole grains. You want to exercise at least 30 minutes a day, 5 times a week. Limit your alcohol consumption. You want to stop smoking and limit your intake of sugary drinks and foods like soda and candy.
So the goals for management of diabetes are to decrease the symptoms, promote well-being, prevent complications, and delay the onset of long-term complications. How do we do this? Teach. You teach the patient that they need to check their blood glucose level, what to eat, and exercise routine they should follow, and the medications that they need to take. Most diabetic patients have to do insulin injections to give their body the insulin that mimics what their own body cannot produce. These are daily shots that are given multiple times a day based on the blood glucose levels. They are given in the fatty parts of the body such as the stomach, the thigh, or the back of the arm. The patient will need to check their blood glucose levels by a finger prick multiple times a day, and this will read the sugar levels in their blood. Patients with type 1 diabetes might have a pump inserted on the trunk of their abdomen that constantly checks their glucose levels, and they can give themselves glucose by the press of a button on the pump. So, The reason why diabetic patients need to be constantly checking their blood glucose levels is because they need to be aware of hypoglycemia, which is dangerously low blood sugar, or hyperglycemia, which is dangerously high blood sugar. So the symptoms of hypoglycemia, which is low blood sugar, would be a glucose reading of less than 50. They might have cool and clammy skin. They might be using the restroom a lot. They could be anxious, irritable, confused, or even have a change in their vision. They might be really, really hungry or just be overall weak. And if it gets really bad, they could have a hypoglycemic seizure. Now for hyperglycemia, which is really high blood sugar, their blood glucose levels will be greater than 250. They could have hot and dry skin. They will not be using the restroom very often. They could be anywhere to alert to comatose. They'll have nausea and vomiting and really bad abdominal pain. They could have rapid, deep respirations with a fruity odor. They could be confused, have a dry mouth, and have weakness.
To close this video out, we want to encourage you to take care of yourself now so you don't get diabetes later. It's an unfortunate disease and mostly preventable, so eat healthy.
Exercise
And check your blood pressure.
See you
See
later.
ya.